Jyoti, any issues in this trial about the chemotherapy piece?
Sure. I mean, certainly I think the design of the trial at first, when we all heard about this, seemed a little bit reckless. What, no rules? You can do whatever chemotherapy you want. You just can't give consolidation. So again, for American practitioners who are so used to doing carboplatin and paclitaxel with consolidation cycles, I mean, this is a game changer. This reflects, I think, real world practice, right? So many patients are getting induction, and up to a quarter of patients did. Because of availability of radiation therapists in different parts of the world. So it may be that systemic therapy started earlier, but all treatment needed to be completed prior to randomization with no consolidation. And a wide range of regimens. And clearly the regimen didn't really seem to matter either. You know, when you look at subgroup analysis, the arms were well balanced, and it's almost dealer's choice. It's very much a real world scenario. Again, one that was surprisingly okay. And so, you know, how this sort of pans out in overall survival will, I think, be of interest. As markers, never smokers, the whole mishmash.
But again, it was a randomized trial, though. So again, the cross-trial comparisons are always tough. But this, we did have a comparison group here. Hey,
and the other thing that I'll say is, some people have commented that they believe the control arm had a surprisingly low progression-free survival. But keep in mind, there's a lead time difference between this and the typical cooperative group trials in that you're counting the time from, let's say, 2 to 10 weeks after chemoradiation as opposed to prior to radiation. So my recollection is the median progression-free survival is just under 6 months. So if you were comparing that to an RTOG trial, that would be more in the 8 to 9 month range.
Almost even up to 12 for some, right? Because you could go up to 6 weeks after concurrent radiation.
Yeah.
So
Yeah, that's correct.
So one other chemo issue in this trial is the use of chemotherapy after the immediate concurrent chemotherapy radiation piece. What is your normal practice now? Once you've completed the concurrent chemotherapy radiation piece, do you give additional chemotherapy?
Since this trial, no. I mean, you know, from patients who've landed in my clinic, it has changed, and have now decided to either treat with cisplatin pemetrexed or cisplatin etoposide, and really have abandoned a weekly lower dose approach with consolidation.
But are you still giving a consolidation chemotherapy?
No.
Or no, this is and you replaced it. And I think that's one of going to be the largest impacts of this trial, is that the use of chemotherapy after the simultaneous chemotherapy and radiation piece of this multimodality program is going to go away. And for the record, there are clinical trials that show that additional chemotherapy, either continuing what you did before or switching to another non-cross-resistant one, did not improve outcomes and enhanced only toxicity. So this might be an additional benefit of this, is that limiting a chemotherapy which is of marginal benefit, and some trials would say no benefit and actually some harm.